After the Arizona Medical Board dismissed the case against Dr. Michael Maxwell, I filed a complaint with the Arizona Ombudsman's Office. I am issuing this complaint against the Arizona Medical Board. My case against Dr. Michael Maxwell was dismissed on August 10, 2011. I received a letter that this was final and is not an appealable action. The case was dismissed based on Dr. Maxwell's answers to 3 questions. Question 1. Where did you get the hypertensive reading for my blood pressure? He answered from the monitors. On pages 799 and 801 of the medical records shows that I had no monitors on at the time of question. My blood pressure was running low, so they checked it manually until the time they took me into surgery. Question number 2. Why did you give her esmolol? Answer. It's standard practice to give some sort of beta blocker before performing heart surgery. He chose esmolol. This is true that beta blockers help with heart surgery. However, he did not document that. On page 2 of 814, Dr. Maxwell states blood pressure down to 150s with esmolol drip. On page 698 of 814, Dr. Maxwell wrote, requiring massive doses of esmolol for blood pressure control. Nowhere in the medical record or operator report did he state using esmolol for heart surgery. Question 3. Was he aware of the addendum changing the diagnosis to pulsation artifact rather than dissection and recommending more tests? The addendum was discussed with and faxed to the ED attending. His answer was no. He signed off on it 21 days later. He was the only doctor attending to me at the time, so what doctor did they speak with? Dr. Maxwell states that if he had done an MRI and it came back negative, he probably would not believe it. He dictated erroneous information in my medical record and passed this erroneous information down to other healthcare providers. On page 700 of 814, Dr. Ramina Jaju dictated that I was found to be very hypertensive. On page 698 of 814, Dr. Thaddeus O'Connor dictated elevated blood pressure requiring massive doses of esmolol for blood pressure control. The attending physician, Dr. Maxwell. Now he has given erroneous information to the board and they believe it without researching the medical record. There is no way that Dr. Maxwell should be allowed to get away with performing heart surgery on a patient with no history or symptoms of a heart problem. He told me he made a mistake. There's nothing wrong with my heart. Only after performing heart surgery, Dr. Maxwell dictated erroneous information in my chart with symptoms consistent with his diagnosis of aortic dissection. I feel saddened that the chance of this happening to another human being is highly likely. Dr. Michael Maxwell has violated the standard of care by subjecting me to unnecessary surgery, pain, and risk of death.
Best deterrent to medical mistakes and errors is the sunlight of information.
So when it's all said and done, I got a life filled with pain, doctors, and drugs.
Now finally, many in this chamber, particularly on the Republican side of the aisle, have long insisted that reforming our medical malpractice laws can help bring down the costs of health care.
You got the bill. The American taxpayers is paying for this. Medicaid is paying for this. And what did they get? Well,
I get it. I get it.
You know, there have been reports just over the last couple of days of insurance companies making record profits. Right now, at a time when everybody's getting hammered, they're making record profits and premiums are going